Hi, my name is Kiran Bhagat, and we've been running a series on cardiovascular disease, lifestyle, prevention, exercise, meditation, mindfulness, the avoidance of certain poisons that we poison ourselves with, the avoidance of agricultural produce that has been fertilized, insecticides, herbicides, pesticides. Make sure you wash your... We've talked about all these things over the last series. Today we're going to talk about some rapid advances in the 21st century. We're turning the year, as I give this session, we're ending 2023 and entering 2024. The major breakthroughs in 2023 from a heart or rather from a health perspective, has really been the development of artificial intelligence, or AI. It has really revolutionized the way we manage ourselves, the way we are monitoring ourselves, the way we are able to do things and empower our community at home. And I live in a country called Botswana, where we are an industrializing nation but are not yet a first world country or a resource-rich country. So we have a mixture of those that live in the urban areas and those that live in the rural areas. And so one of the things I want to talk about initially in terms of breakthrough in advances in healthcare is really simple technology. And the most simple technology that we're now increasingly utilizing is a cell phone. We have patients in our part of the world that live in very remote parts of the world, and we're now able to communicate with them on all sorts of social apps, whether it's WhatsApp, whether it's an SMS, whether it's the technology of video conferencing, in order to indicate to ourselves, somebody who's in heart failure, somebody who's had a heart attack or a stroke, we can actually see on a video conference call, whether it's on a WhatsApp or even a Zoom, whether they're getting better. We can actually instruct them how to exercise, how to measure their blood pressure, how to measure their sugars. Whereas before, if they left for a village 15,000 or 1,500 kilometers away, we were not able to communicate with them until we saw them 6 months later. So we wouldn't understand what has gone wrong. So this really has made a major advance to resource-poor countries, where we're using cell phone technology, because even the elderly are now beginning to learn to SMS, learn to WhatsApp, learn to communicate on a cell phone with their doctors to say, I'm not feeling well, I'm feeling dizzy, this pill is causing X, Y, and Z. And this has revolutionized how post-discharge management has occurred. It may sound like a small thing for big people in an urban setting, but for us it has revolutionized the management of diabetes, blood pressure, sugar control, stroke, etc. The other thing in this year that has really taken off in a big way are the devices that people wear on themselves. We're talking about these watches, the Fitbits, the devices that they're carrying around with them, the cell phone technology that is linked to the watch on their wrist, that measures the number of steps that you take, that measure the calories burned, that some measure the pulse. Some cellular phones are actually measuring ECG or electrocardiograms. They can actually tell you the rhythm of the heart. Some are indicating whether you've had enough sleep, whether you've lacked sleep, whether you've had the right sleep, whether you've been lying in bed but not actually sleeping. So this information can be downloaded and sent to the doctor and to be understood in terms of whether it's the blood pressure, because there are machines now, watches coming out that can measure blood pressure continuously, and you can download that and send that to your doctor. There are watches coming out in 2024 that measure sugar continuously without actually pricking yourself. This will be able to revolutionize the way patients actually manage their diet, because the phone will alarm every time they eat something sugary in order to understand. So the patient will say, aha, I can't have oats or bran or cornflakes or bananas because it spikes my sugar. So these things are going to empower the way patients look after themselves at home rather than the need to travel into a hospital, particularly some of the elderly who are not able to get into a hospital. So this is another revolution in terms of AI technology. The third one is going to be remote control system assisted devices, where we begin to actually be able to operate on somebody thousands of kilometers away, where you have a specialist in a teaching hospital linked up to a rural area, connected by AI technology and Zoom, to teach the doctor at the other end in the rural village how to operate, how to deliver a complex baby, how to suture a major laceration, because the specialist surgeon in the teaching hospital is able to do a Zoom conference with an artificial technology hookup to say, this is how you suture, this is how you stitch, this is how you put in the battery in the heart. And this has also revolutionized management, particularly as we see global changes within our environment. The other thing that has changed in terms of technology and may actually see a displacement of some of the old practice of medicine is where AI is now actually taking over the interpretation of some of the things that doctors used to interpret, and at a much better, faster ability than some of the humans. We now know that AI technology is able to read and interpret X-rays and CT scans and MRI scans far better than a radiologist can, because all you need to do is to fit into that database billions and billions of X-rays or CT scans, and that technology, particularly with quantum computers, is going to be able to lap up that information, digitize that data, and be able to understand what a normal X-ray looks like, what an abnormal X-ray looks like. A radiologist may be tired at the end of the day, and because he's tired may not look at the X-ray properly or the CT scan and may miss something. And AI technology doesn't get tired, and so we're able to churn out much more rapid interpretation of X-rays, ECGs, laboratory values, MRI scans, etc. Understanding of pacemakers is done better by technology. Understanding whether you have eye disease, an AI technology can look at the back of your eye and actually see where the blood vessels and circulation are traveling across your eye in a normal fashion, to pick up diabetes early, pick up blood pressure early, pick up signs of blindness, imminent blindness early. So these are the things that are coming through in 2024. We know the Japanese are working very heavily on what is called the smart toilet. Believe it or not, we know that your wee and your poo are very important signals of what's going on in your body. If your urine is of a different color, of a different chemistry, the smart toilet will light up. There are going to be individualized toilets where this is a toilet for Joe Bloggs, and if he pees and poos in that toilet on a regular basis, that smart toilet is going to be understanding the right type of texture and quantity and bacteria in your poo. If that bacteria changes, if there's blood in the poo, if there's mucus in the poo, that toilet will light up to say, Joe Bloggs, there's a change in your poo, go and see your doctor. Or if your urine is a certain color and a certain chemistry and a certain pH, if it changes, if there's blood, if there's protein, if there's an acidity to the urine, it'll light up to say there's something wrong. It'll pick up early signs of kidney disease, cancer, bowel polyps and bowel cancer. So this is the smart toilet that's coming. So all these tools are there to empower the public rather than the practitioner, to put the hands of health firmly into the public hands rather than in isolated glittering big hospitals that occurred in the past.